A lack of planning on your part is not an emergency on my part, but if you're really in a sticky situation, use all the pentobarbital that you can find, throw in some lidocaine if you think you can, and hope for the best. So you need to sedate your friendly neighbourhood werewolf. Hypothetically, of course. Now I am assuming and hoping that you have the best interests of the friendly neighbourhood werewolf at heart, because otherwise why would you be trying to sedate it instead of dispatch it? So I'm going to go through some actual sedative options to help the poor, misunderstood puppy go through their hardest time of the month. My name is Dr. Ferox, and I am not a human doctor. In my day job, I'm a veterinarian, which means I've had to anaesthetize or sedate plenty of highly opinionated canids. So I think there's a reasonable chance we can find a concoction that will work. Hypothetically, a werewolf is just somewhere between wolf and human. The metabolism isn't something super weird, like in an undead situation. It might be supernatural, but supernatural is really just enhanced natural. If a werewolf has a respiratory system and a cardiovascular system and a nervous system, we've got plenty to work with, hypothetically. Now, those of you that have done their research might be thinking that wolfsbane is going to be relevant somehow. And that's a reasonable place to start. Lots of stories and legends will claim that either wolfbane cures the werewolf or weakens it somehow. And that's interesting because being affected by wolfsbane implies that the werewolf has physiology that we can interfere with. This is the Herbalist's Primer, and it's an excellent resource for general herbalism information, including mythology around herbs, if you're interested in that sort of thing. The active ingredient in wolfsbane, the molecule that makes the plant potentially lethal for you as a normal human to even touch, is aconitine. It's a potent alkaloid that has both cardiotoxic and neurotoxic properties in normal humans and indeed in most mammals. So if a poor werewolf is affected by wolfsbane, it's almost certainly being affected by aconitine. Symptoms of aconitine poisoning include tingling or numbness of the skin or the face or whatever touched the plant, nausea, vomiting, general gut upsets, cardiac arrhythmias where the heart is not beating properly, a slowed heart rate, low blood pressure, and it can potentially paralyze, including paralysis of the heart muscles or the respiratory muscles. And that sounds like a lot of symptoms. But those of us who are medically inclined know the difference between a medication and a poison is just the dose. And we might also be thinking that list of symptoms sounds an awful lot like lidocaine. And they'd be right. Now, for a very brief foray into physiology, without making it too complicated, animals of all kinds, including werewolves and humans, are basically organizations of cells floating in electrolyte solutions. And the most common electrolyte is going to be salt, good old sodium chloride. Cells can selectively push those ions individually across their cell membranes to generate electrical charges, which allows functions like muscle contractions and neurons to fire. Aconitine from wolfsbane selectively binds to sodium-gated ion channels, specifically the alpha subunit 2. Lidocaine specifically binds to sodium-gated ion channels, alpha subunits 5, 9, and 10. So while it is not an exact analog, it's really, really close, binding to different sections of the same ion channel. So it's very reasonable to assume that if a werewolf is affected by wolfsbane, it has the relevant sodium channels, and it will also be affected by lidocaine. Now, admittedly, there are a couple of substances in the world that are even more similar to wolfsbane than lidocaine is, and so they would likely affect werewolves. But they include things like pufferfish toxin and blue-ringed octopus toxin and poison dart frog toxins. So not only are those things very unlikely to be available in the vet clinic, but the poison dart frog toxin in particular binds permanently, which means that it cannot be waited out and it's very likely to be lethal, even if your poor werewolf is in their wolfy sort of shape. So if you can't get wolfsbane, and that would be no surprise because frankly that plant is very toxic, potentially even to touch, and probably shouldn't be grown in suburbia when there's small children running about, you can potentially substitute it for lidocaine. And you can mix lidocaine with other anesthetics to enhance the ability of that anesthetic. And if your werewolf is affected by wolfsbane, it's probably affected by aconitine, which means it probably has the sodium-gated ion channels, then it really should also have the opposite, the chloride-gated ion channels, because otherwise you're just going to get weird electrical charges and probably no movement happening. And it is the chloride-gated ion channels which are affected by barbiturate anesthetics, like pentobarbital, which you will find huge quantities in basically any vet clinic. Now, personally, in my experience, hypothetically, I would expect most anesthetic agents to have some effect on a werewolf, and I will go over them all briefly, but I think you'll find the barbiturate class of anesthetic is going to be the surest bet. Now, I will, of course, deny having treated any werewolves before, and so will you, but it would hypothetically be legal. If a werewolf is not considered to be human, then that falls under the purview of the animal kingdom, which is veterinary medicine. If a werewolf is considered human, but there is not a more suitably qualified human medical practitioner available, as a veterinarian, I would be allowed to treat one in an emergency. So all perfectly, hypothetically legal. So this hypothetical advice is based on the following assumptions: that the metabolism of a werewolf is somewhere between canine and human physiology, but perhaps accelerated because of the supernatural situation. That the werewolf is reasonably large, at least 80 kilos. That the werewolf is in reasonably fit or athletic condition when it's in the wolfy shape. And that the poor werewolf, whether in a fearful panic or angry rage, is pretty full of adrenaline. But the one assumption I cannot make is whether or not you can give our werewolf friend an injection. Because the most commonly used needles in this day and age are actually made of stainless steel. There's not really any silver ones in the clinic. If the type of werewolf you are handling requires silver to pierce the hide, you're going to have to Google your own silver needles. But if you are thinking that applying silver to the skin might give you an opportunity, I'm sorry to say there's not terribly much in a vet clinic that has silver in it. You may find some Silverdene cream, which is used for burns, but that is 1% silver at best. And silver eye drops are very rare, and they're not much stronger than that. There is also the matter of getting close enough to actually inject the poor, misunderstood puppy. But worry not, there is more than one way to sedate a werewolf. Hypothetically. For those unfamiliar with the process, anesthetics and sedatives function on a spectrum, with consciousness at the top and death at the bottom. I use the terms fairly interchangeably because in sedation, the patient is still kind of aware of what's going on, and under anesthesia they are not, but a heavy sedation can turn into an anesthetic fairly easily. You probably want your werewolf to be anesthetized so that it is not trying to eat anybody. Now, we want our werewolf to reach the third stage of anesthesia, which is surgical anesthesia, where they are not really aware, not really sensitive, but they still breathe on their own. Due to risk of transmission, you don't really want to be doing mouth-to-mouth resuscitation on a werewolf, because then you will potentially give yourself an entirely new problem. But to reach the third stage of anesthesia, they need to go through the second stage of anesthesia, which is sometimes called excitement or delirium. For reference, the second stage of anesthesia is why certain people use medications to chase a type of high in an illegal manner. Medications like propofol, xylazine, cocaine and heroin are used by people chasing that high because it produces a very long stage 2 anesthesia. They can all produce stage 3 anesthesia at high dose or death at higher doses, but because they have a long excitement phase, people are drawn to them in a recreational manner. We do not want a long excitement phase for our werewolf. We do not want them to be high or delirious or tripping balls. We want them to be safely asleep as fast as possible. And for your safety, you need to know that stage 2 anesthesia can occur both when the werewolf is falling asleep and when they are waking up again. It's also worth noting that certain modern anesthetics, particularly intravenous ones, don't actually have to be metabolized to allow a patient to wake up. Rather, these medications are redistributed into fat. Your brain, your mammalian brain, and presumably the werewolf brain, has quite a lot of fat in it. So when these medications are given intravenously, they dissolve into the brain very quickly, causing unconsciousness. And then in subsequent cardiovascular cycles, it dissolves out of the fat in the brain and it redistributes into fat elsewhere in the body. That allows consciousness. And that means that a werewolf who has some body fat on them will wake up quite quickly and quite easily. This is why historically dogs like greyhounds, who are very lean, were notorious for having difficult anesthetics and a fairly long hangover effect, because there just isn't enough fat in the body to redistribute the drugs to. Now, our hypothetical werewolf could be quite lean in their wolfy form, which means they might take less medication per kilo of body weight than you're initially expecting for them to go down. But if they're on the chunky side, they are going to require a lot more medication to stay asleep. Sedatives, anesthetics, and tranquilizers also do not work instantly either. If Poochie's jaws are already breaking through the pharmacy door, it's a little bit late for you. You should have concocted a plan ages ago. It's going to take several minutes, maybe even half an hour, for any of those medications to kick in. And if the werewolf is frightened, anxious, in a rage, or otherwise full of adrenaline, they can fight and resist the anesthetic. So you should concoct your plan now and not when you are in a crisis. Now, I obviously have perfectly legal access to all of these medications through my job as a veterinarian and my legal prescribing rights. I am assuming in this purely hypothetical situation that you also have perfectly legal access to all these medications, which would be locked away in the vet clinic pharmacy or safe. And if that is not the case, perhaps you should be consulting a lawyer who knows about lockpicking. Now, if you are going to inject your werewolf with anything because you either have silver needles or it turns out that you just can, there are a few different types of locations you can consider. Intravenous access is going to give you the fastest effect of the medication, but it takes skill to hit a phone, especially in a resisting patient. An experienced clinician or talented vampire could probably do it, but I don't expect you to if you're an amateur. Veins are small, wiggly, and only superficial in a couple of locations. If you have a willing and compliant werewolf, you might be able to use a silver blade to make a very shallow cut over a vein and then thread a catheter through it. This does require practice, but it's the best intravenous access that you're going to get if your werewolf friend is compliant. And if you do not have access to any sort of silver blade, perhaps reevaluate your life. Intramuscular is your next option. Muscles have a decent blood supply, so they'll absorb medication reasonably well and quickly, but some medications will hurt if they're given outside a vein. Some will cause tissue damage as well, but werewolves typically heal very quickly. As a general rule, if you can see the bulging muscle, it's a decent target. A very strong thrashing patient can bend the needle, so be aware, and larger volumes will take a longer time to inject, so you are less likely to get the full dose if you are injecting 20 mils as opposed to 2 mils. If you can't pick out a decent sized muscle on the arm or the leg, or potentially either side of the buttocks, you could consider doing the neck muscles. They are either side of the spine at the back of the neck. You do not want to go down the front of the neck or either side of the front of the neck, which is where the airway and the big blood vessels are. And you don't want to be exactly in the midline because that's where bone is. But just a little bit either side will have quite decent, strong muscles with a good blood supply. Besides, the hardest place for a werewolf to bite is directly behind its own head. If you miss the muscle, you might have injected subcutaneously or just intra-werewolf. Those injections will still be absorbed, but at a much slower rate. And if the rate of absorption matches the rate of metabolism, you might not see any clinical effect at all. If, on the other hand, you cannot inject a werewolf, either because you have nothing silver to pierce the hide, or you just can't, you still have a few options left. There are more than one way to sedate a werewolf. Hypothetically. Oral administration means that your werewolf has eaten the sedatives. Medication that gets eaten needs to be digested and then metabolized by the liver. So a round of metabolism happens before those medications can actually reach the brain and cause unconsciousness. This is called the first pass effect. Because all the eaten medication goes to the liver before the brain, you might need extremely high doses of medication to have an effect. Buccal means that the medication is absorbed across the skin of the mouth. That could be the gums or that could be the inside of the cheek, where the skin is not furry. Some medications can be absorbed this way without being swallowed, and that means they don't get digested, they don't go past the liver before they reach the rest of the circulation. So you can get away with a lower dose with medication administered this way. This trick can also work across the conjunctiva, or the surface of the eye, and potentially also up the nose if the opportunity presents itself. Functionally, that means that you can squirt medication on the werewolf's face, and it can either absorb across the eye or lick it off its face and still get some effect. That is because the lining of this anatomy is not skin, it's mucous membranes. And there are also mucous membranes at the other end of the gut. Rectal administration means putting the medication into the rectum. The rectum can actually absorb quite a lot of different medications. And because they're not going through the stomach and the small intestine, they don't get metabolized by the liver before they reach the rest of the circulation. So you can get away with a lower dose giving a sedative via the rectum than if it was eaten. Plus, there should be no teeth at the rectal end, although how you access that part of the werewolf should be a personal discussion between the two of you. Now, assuming you can effectively medicate a werewolf, what do you use? The first thing you might reach for is Zolotil, my beloved cocktail for handling the wild, angry, and dangerous. It's a combination of teletamine and zolazepam. We use it mostly for wildlife and extremely aggressive dogs, for which a werewolf would qualify. But in a zoo situation, you can use it for everything from chimpanzees to polar bears. A massive dose, like the whole bottle, will knock a human person out for about 20 hours or so. So even with a very rapid metabolism, you should get some sort of effect in a werewolf. If you do use bucket loads, they may have trouble breathing, but if they're that unconscious, they're not moving, you could place an endotracheal tube and breathe for the poor puppy. After all, you just do still want that patient here in the morning. Now, ketamine, known colloquially as horse tranquilizer, will also tranquilize just about anything else. It works on all mammals, but the effect is dependent upon the dose. Remember, you want your werewolf at stage 3 anesthesia, not at stage 2 where they are tripping balls. Not every vet clinic will have ketamine in the building because a bunch of them do not want to risk getting robbed for it. Ketamine is related to the teletamine in Zolotil, but generally speaking, a combination of 2 medications is more likely to work than just using one medication on its own. In veterinary medicine, ketamine is often administered alongside a benzodiazepine like Valium for anesthesia. But Valium can be pushed through, especially if an animal is young, fit, athletic, or hyped up on adrenaline, and your werewolf could be all of those. Plus, Valium is not particularly strong, and it is fairly notorious for causing the munchies, which is not really the purpose of the exercise. Now, alfaxolone is by far my personal favourite anaesthetic agent. Great if you can hit a vein, still pretty darn good if you can only hit a muscle, but you will need a large volume to induce proper anaesthesia. It's relatively safe, but it does often cause delirium when they're waking up, and if you get it into a muscle, it will sting, so the werewolf won't appreciate it very much. The downside for alfaxolone is that it's metabolized by every single cell in the body on a progesterone pathway. It's not dependent upon liver or kidneys to be cleared. So if a werewolf has super rapid metabolism, the alfaxolone is not going to last very long. But if you have intravenous access, you could put it on a constant rate infusion, which is a continuous drip of alfaxolone in order to maintain the anesthetic. And once the werewolf state has worn off, you can just turn off the drip and they'll be awake in half an hour. Propofol is kind of similar but not quite as convenient as alfaxolone, and you really need intravenous access for it to be much use in a werewolf situation. Now, many vet clinics will have some kind of opioid in the building, but they work best for sedation rather than anesthesia, and they're usually used in combination with something else. They are also supposed to be very locked away because opioids are drugs of addiction. Morphine, methadone, and butorphanol could increase your chances of effectively sedating the werewolf, but they're not as heavy-hitting as the previous medications. And if you have used enough of the opioids to induce sedation on its own, there's probably not a lot of breathing happening. Fentanyl is another opioid that has a reputation for being a scary street drug because it has rapid onset, but it also wears off quickly. So in a werewolf with rapid metabolism, it's probably not going to have a long clinical effect. You're going to blink and miss it. Do not confuse morphine with apomorphine. Apomorphine sounds very similar, but it's usually not kept as heavily locked away because it does not cause significant sedation. It causes vomiting, and lots of it. So while the apomorphine will probably inconvenience your werewolf greatly, it's not going to stop her. If, on the other hand, you come across etorphine, it will probably sedate the werewolf, but it might actually be as equally dangerous to you, the perfectly normal human, as the werewolf is. Etorphine is very rarely used in veterinary medicine. It is basically reserved for knocking out very large game like elephants or rhinoceros. You are supposed to have the antidote to etorphine already drawn up in the hands of a suitably trained medical professional standing a few meters away from you, just in case you accidentally prick or expose yourself to etorphine, because it is so potentially lethal. It's so rarely used that it's not even manufactured every year. But if you do come across it for some reason, treat it with the utmost respect. Now, phenobarbital is used as an anti-seizure medication. If you give it intramuscularly, it will hurt a lot, and there may not be enough of it on the shelf in a typical clinic to knock out a werewolf effectively, but it's usually kept in tablet form. A willing werewolf could just eat it. You'll probably find it in 1 ml vials, but you'll need multiple of those to adequately sedate a large dog, let alone a decent werewolf. Pentobarbital, on the other hand, is typically present in very large quantities, like a 450 ml bottle at the clinic, and in a highly concentrated solution because it's the death juice. It's the lethal barbiturate, the euthanasia solution. A very small dose will cause anesthesia, but a typical dose would cause anesthesia followed by death. And small dose is relative when talking about a very large werewolf with supernaturally rapid metabolism. A big bottle is potent enough to euthanize about a ton of mammal, so there is a very good chance that you will have enough medication to affect the werewolf. A smaller dose is more convenient when injecting an unwilling patient, but the downside is that if you give it into a muscle or outside a vein, it burns. It's extremely alkaline and it's going to hurt a lot. Your werewolf, well, she'll heal pretty quickly, but she's going to have very strong opinions about that experience. And do not, in any circumstance, be tempted to administer pentobarbital via the rectum if you are expecting your friendly neighbourhood werewolf to still be friendly in the morning. Pentobarbital is pretty easy to identify because it's typically very brightly coloured. Ours is bright green, but if you are overseas it might be bright pink or bright blue, and nothing else will look like it because the death juice is unmistakable. The third barbiturate you might find is thiopentone, which is a very old school anaesthetic. It's not as common these days, but it might still be out there. It is dependent on fat redistribution to let the werewolf wake up. So it does take a long time to metabolize if it's given into the vein. If you can get it in, it might still be effective, but it's not very common anymore. And if your werewolf is lean, it will probably stay asleep for longer. Medetomidine and dexmedetomidine are very effective sedatives. Typically, you would only use them in young, fit, healthy animals, which your werewolf almost certainly is. It can be fought through, so use a very generous dose, and it's best combined with other medications. Seriously, don't hold back on the medetomidine because there's an antidote that comes with it. So if you have overdone it, you can reverse it. Acepromazine is a very old school sedative, but unfortunately unlikely to do anything in an athletic, strongly opinionated werewolf with fast metabolism, so it's probably not worth the time it would take to inject. And if the werewolf has enough adrenaline in their system, they're basically going to push through it and ignore it anyway. Attempting to knock out a werewolf with anesthetic gas is also probably a waste of time. While anesthetic gases aren't really metabolized as much, so much as breathed out to cause consciousness, thus ignoring the problem of a very rapid metabolism, your typical mammal is going to need to breathe about 5% if they don't have any other medications on board in order to go under. And there's potentially a very long excitement phase while they're struggling against it. And if you're trying to flood a room with anesthetic gas to get to that 5% point, it takes a lot, and you would have to seal the room, and you're at risk of displacing the oxygen needed to keep the werewolf alive. It's also a fire hazard, and please do not attempt to rig up a solution by putting a plastic bag over the werewolf's head and flooding the anesthetic gas in there. Again, you have a risk of suffocation, of displacing the oxygen needed for life, and it's probably not going to work. The amount of time it takes to knock a werewolf out that way will cause panic and it's going to rip the whole contraption off its head. Now, the medications you could spray directly into the snapping mouth of the werewolf and still reasonably expect them to have some effect, whether they're swallowed or not, are ketamine, medetomidine, and the barbiturates, phenobarbital or pentobarbital. And once you have some effect and that werewolf is slowed down a little, you can always just give more. There are more medications on the list that could be effective per rectum, but technical application could be challenging. And you should ideally discuss that with your werewolf before she transforms. If you can convince the werewolf to eat some sedatives, then ketamine, the barbiturates, or Zolotil is your best shot at achieving sedation. But sedatives going to the stomach will take a while to be digested and absorbed into the system. Now that means, and don't worry, I won't snitch, I'm not that sort of character. If you are the werewolf, you could potentially swallow a bunch of sedatives before transforming, and it may well be a viable way for you to render yourself unconscious for the night, or at least give yourself a head start for that particular lunar cycle. If you are not the werewolf, those medications can be injected into meat and potentially convince the poor puppy to eat them, or melted ice cream is generally quite well received by carnivores. In a pinch, If you are in an emergency situation in the vet clinic with a werewolf, there will be a freezer out the back of the building somewhere. And in that freezer, there will be deceased animals, most of which have been pumped full of pentobarbital. That pentobarbital is still active, and it will affect any creature that eats them. So while they may have been beloved pets in life, if you are trying to survive a horror situation, you do what you have to do. You can also consider leaving some of this laced meat out near your sedated werewolf to consume if it starts to wake up quicker than you were expecting. Especially if you did use a barbiturate, because they typically also induce the munchies when they wake up. So in conclusion, if you are the poor little werewolf, drink the barbiturates, or if none are available, use Zolatil or medetomidine about 10 to 30 minutes before you expect to turn. Surround yourself with laced meat or ice cream and lock yourself in. If you are not the werewolf, get one or a combo of the previous mentioned medications into the creature, either by feeding it or spraying it in the face. If it licks the sedatives off its face, it's still partially effective. Consider whether once it's a bit dopey, you can gain further access, either by cutting down onto a vein, the back door access, or further buccal access. As the werewolf gets drowsy, you just keep topping up the dose. And consider covering the poor thing with heavy blankets or aluminium foil to block out the moonlight. Now, there are not going to be enough published studies, for reasons, about werewolf metabolism out there to accurately guess dosages, but generally speaking, dosages will just be lots and lots. Start at the domestic dog dose per kilo and then amplify it. You can titrate doses to the desired effect. If it's not enough, just give more. If it's too much, wait it out. We've all needed a little extra support at one time or another during our roughest time of the month. A werewolf doesn't necessarily mean all the things she says or does while transformed and deserves a little understanding. Who among us hasn't said or eaten something that they've regretted during their most challenging time of the month? Oh, and by the way, different species may react differently to the various medications. So if it's not exactly a werewolf that you're treating, you might need to change your strategy. Feline lycanthropes are usually going to be much more sensitive to ketamine and friends, and a reptilian lycanthrope may not respond to the opioids at all. Hypothetically, of course. Thank you for listening. My name is Dr. Ferox. If you have other speculative biology questions, feel free to drop them into the comments below. These videos are very sporadic in nature. There is no set schedule. So if you want to see the next one, feel free to subscribe, and I will see you in the next video. Bye.